Welcome to Now We're Getting Somewhere. I'm Katie, and I'm a certified life coach, but I've also been a management consultant at McKinsey and a product manager at a tech startup. In other words, I know what it feels like to have a life that looks pretty good on paper, but doesn't feel as good as I want it to. I help my professional clients develop lives that are more meaningful, happy, and also more successful. And I want to share the same practical insights with you. Let's go. Today, I wanted to speak to some of the differences between coaching and therapy. Whenever I get on a consultation with someone who's interested in working with me one-on-one, I offer hour-long consultations and we chat about, what's going on for them and also any questions that they have about coaching so we can see if it's a good fit. One of the most common questions that I get on those consultations is, what's the difference between coaching and therapy? And I'm always really happy to answer that question because I actually think it's a good question. I think coaching is a newer field than therapy. And while most people I encounter have either been in therapy themselves or at least know someone who's been in therapy, for many people, they have never been in coaching and they don't know anyone who has been coached before. So it occurred to me recently that I should answer that question here on the podcast. You shouldn't have to wait until you have a consultation with me to hear my answer. So that's what I want to do today. I'm going to speak to some of the differences between coaching and therapy in a few ways. I will start by sharing my favorite metaphor about the differences between the fields, the one that I think is the most helpful. Then I will talk more about the origins of the fields, differences in training, and also just how it can feel different when you are actually in the sessions themselves. I'll also share one difference between coaching and therapy that I often hear described, but I don't totally agree with. My goal is that you will walk away from this podcast with a better understanding of what kinds of challenges are best served by therapy, what are best served by coaching, and how to decide if you need a therapist or a coach. But before we get into all that, I just wanted to make two quick notes. The first one is to name that even though the purpose of this podcast episode is to point out the differences between one-on-one life coaching and one-on-one therapy, obviously we could also talk about group work or courses or other things, but we'll stick to one-on-one work here. There are a lot of similarities between both coaching and therapy. With both a one-on-one coaching or a one-on-one therapy relationship, most of the work is going to be in these one-on-one conversations with your practitioner. In both therapy and coaching, you will also be talking a lot about yourself, your life, your struggles, your yearnings. Some big emotions like fear or sadness or anger might also come up in both therapy or coaching. And as a side note, that's actually a pretty common misconception about coaching. People often think that they can't bring big emotions to coaching because it's not therapy. Actually, you can totally bring big emotions to coaching. Big emotions are part of the normal human experience, and I want you to bring your whole self, your whole human self to our coaching sessions. You'll get better results that way. So yes, big emotions would be welcome probably in both contexts. There's also many tools or techniques that both a therapist or a coach might use. So focusing or felt sense work, which is my preferred kind of methodology for accessing body sensations. That might be used by both coaches or therapists. Working with your thoughts, again, is something that I do often with clients, and many different types of therapists, especially a cognitive behavioral therapy practicing therapist would certainly do. So depending on the modality or the toolkit of your practitioner, there can, but isn't always, but there can be a certain amount of overlap between life coaching and therapy. So that's the first thing I wanted to kind of give as an upfront note. The second thing to note is that obviously both fields are very large and diverse. So for purposes of this podcast, I'm going to contrast an integral coaching form of life coaching with a generalized form of psychotherapy. I'll say a little bit more about what I mean when I say that. Integral coaching is the type of coaching I was trained in. It's what I practice. That's a kind of fancy word, but it really just refers to, one, thinking about my client as a whole person, leaving nothing out, and also just trying to bring as full or as integral a toolkit as possible to the problem. So not just the thoughts or just the body or just your actions or just your relationships, but trying to think about you from many different lenses. And when I refer to life coaching, I really just mean life coaching across your life, not just, for example, your professional life or just, for example, your marriage, but everything. And as I said, I'm going to be comparing that to a kind of generalized form of psychotherapy. Obviously, the word therapy is actually quite a general word that could refer to many things like speech therapy or occupational therapy. So psychotherapy just refers to the kind of talk therapy that most of you were probably already envisioning in your mind when I even sort of talked about therapy versus coaching. But I think it's worth it to just sort of clarify the terms before we begin. And of course, I'm sure it goes without being said that I could never be an official representative for all of psychotherapy. I'm not even a therapist myself. So I will be very clear about how I have developed these generalizations. They are based on my own experiences in therapy myself, also on my conversations with friends and loved ones who have been in therapy. And third, they're based on my conversations with many of my clients who have been in therapy before working with me. And typically at some point in our work together, they will share with me how they have experienced coaching as different from therapy. In fact, if you've listened to any of the podcasts I've done with past clients, I'll usually even ask that in almost every single one of those because many of those folks have also been in therapy. So it's just something I actually hear that contrast a lot by people who have been in the client seat in both scenarios. And of course, whenever you make generalizations, there's always going to be exceptions, there's always going to be variation, and some folks may disagree with me. But I will attempt to do this as best I can, as fair-handedly as I can, given the obvious disclaimer that, of course, I'm a coach, so my true expertise will always be with my own profession. So with that all in mind, let's talk about some of the differences between therapy and coaching. So the first thing I wanted to offer, as I mentioned at the beginning, is my favorite metaphor, the metaphor that I think is the most useful for describing the differences between therapy and coaching. And it's this. If you were playing on a sports team, if you were a gymnast or a soccer player or a track runner, the therapist would be the team doctor or the team physical therapist, the team PT. And the life coach would be the actual coach on the field. So the therapist as the team doctor or PT and the coach as the coach. The key point about this, first and foremost, is that they both play essential roles. There is room for both, and both can do a little bit of both, but they will excel at slightly different things. You will go to the doctor or the PT without a doubt, period, full stop, when you are injured and recovering. And conversely, you will go to a coach when you're basically okay, you're uninjured, but you want to address some problems with your playing or become even better than you are already. In fact, on one hand, you might be playing pretty poorly. You might be losing a lot of games, but you could still go to your coach. And on the flip side, you might actually be doing amazingly, but you would also still go to your coach. Like, you better believe that Simone Biles has a gymnastics coach. And I would feel quite confident that her coach is a key part of how she stays at the top of her game and how she improves. So there's two important things about this metaphor that feel really important to kind of underline and highlight for you. The first is, as I alluded to before, if you are injured, if you are ill, if you are recovering from injury or illness, you must, and I mean must, go to see that doctor or PT. I use injury and illness in the context of this sports metaphor, but in the therapy versus coaching comparison, that would mean if you had a mental illness like bipolar or schizophrenia or an eating disorder, or if you had serious trauma, like you had experienced physical or emotional or sexual abuse, and you are still significantly impacted by it, you need to be seeing a therapist. People who are experiencing mental illness or serious trauma, they need a lot of support, and they need very specialized support. In many ways, they are fragile, and therapists, this is what they spend a lot of their training on how to deal with people in these kinds of very sensitive, very tender situations with a lot of care. This is astonishingly important work, and it's just not what coaches are trained to do, and it's not what coaches are skillful at doing. This is not to say that you can't also have a coach. I definitely have situations where I have clients who have been in therapy or currently even are seeing a therapist who see me as well. But if you came to your soccer coach and you had a broken ankle, any good coach would send you straight to the doctor first and tell you, come back only when you have talked to them and established care first. And I would, and frankly have done the same. if someone comes to me with issues and I can feel that they are tender in that way or struggling in that more serious way. So that's one important takeaway that I want to give to you from this metaphor. That if you have a mental illness or serious trauma, please do go see a therapist. They're that team doctor, the team PT. They're going to help get you back to functioning. The second thing that I think this metaphor illustrates really well too is kind of the opposite side of the spectrum. I will not infrequently come across people who are kind of just feeling a little blah in their lives, a little dull or stagnant, maybe really exhausted or burnt out, maybe yearning for something more but struggling to get traction towards that. And in our modern society, some percentage of those people won't really know what to do with those feelings or thoughts, but they've kind of like heard that therapists help with feelings and thoughts and stuff like that. So they'll go see a therapist. And sometimes they will come across a therapist who's just really good at that kind of work, like taking you from already solidly functioning to something more, perhaps to thriving. But in my experience, for many other people, therapy sometimes doesn't quite hit the spot they were hoping to hit. It can be really nice. It can be helpful in some ways. And sometimes it might be pleasant or relieving. But in many situations, and this in particular is what my clients tell me, they were maybe hoping for a little more oomph. Like, again, many of my clients who eventually find their way to me after being in therapy, they'll tell me things like, oh yeah, therapy was pretty good. But I kind of felt like I just talked about how I felt and the therapist kind of listened, and I'm not really sure if, what was really supposed to happen. It didn't really feel like a ton happened. And in the context of the metaphor that I shared just now about the sports team, that would actually be like, wanting to improve this issue that you keep having with your corner kicks or your back handspring, and you go to see your team's PT or your team's doctor. And it's not that the PT or the doctor have nothing to say about that. Some of them actually probably have really good insights. But with those kinds of issues, you would really, really benefit from talking to your coach. Those kinds of issues would be your coach's bread and butter. And to bring it back to coaching, helping people who feel a little dull or blah, or like they're just kind of spinning their wheels and can't get traction towards something they're wanting, those are bread and butter life coaching issues. If you have issues around energy or meaning or relationships or developing and executing a vision for your life, again, those are bread and butter life coaching issues. And again, it's not that a therapist couldn't be helpful on those kinds of issues. It might just be a little more hit or miss. Like you might get someone who could help, or it just might not feel as potent, or you're making as much progress forward. Whereas this is what life coaches specialize in. So that's part of why I really wanted to make this episode, because I think people, at least some of the time, are seeing a therapist when they actually need a coach. So if you take nothing else away from this episode, I hope you will take away this sports metaphor, because I think it kind of intuitively makes a couple of key things clear. And for the rest of this episode, I'm going to hit a few other things. I'm going to talk a bit more about the origin of the fields. I'm going to talk about some differences in training. And I'm going to talk about how I think they feel different in the client seat. So first, as I said, let's talk about the differences in the origins of the field. So one obvious origin in the field of therapy, of course, is medicine, because many, if not most, of the original practitioners in the field of therapy were doctors. Just to name a few, Franz Mesmer, who's an Austrian physician, is credited by some as one of the early founders of the field of psychotherapy in the late 1700s and early 1800s. He was basically trying to hypnotize people. He called that mesmerism, so the word mesmerize actually comes from that. Mesmer, Franz Mesmer, he was a doctor. There was also a French physician named Philippe Pinel who founded the field of psychiatry as he tried to find, humane ways to treat people with mental illnesses. Philippe Pinel, he was also a doctor. Freud, obviously he's a biggie in the field. He was a neurologist. And to this day, the medical and the psychotherapy fields are intertwined. You no longer have to be a doctor to be a therapist, though psychiatrists, for example, who often do practice therapy, they, of course, are trained medical doctors. But whether you are a doctor or not, one of the core, for example, essential texts of the field of therapy is still the DSM, which stands for the Diagnostic and Statistic Manual of Mental Disorders. This is a book that lists out all the mental disorders a person could have, and it helps practitioners to diagnose, just like a doctor would do. And I want to be really fair here to therapists, as fair as I possibly can. I think a lot of them now in 2023, as I'm recording this, are probably not always super interested in that kind of diagnosis and treatment-based model of thinking about their patients. I think there's a lot of movement in the field now, to my understanding at least, about things like positive psychology, where again, it's less about diagnosing and treating disorders. It's more about identifying positive opportunities. But also, I think it should be said that if they want to get reimbursed by insurance, another way in which therapy and the medical world are intertwined, that for many people, insurance pays for therapy. Typically, to my understanding, therapists are required to diagnose you with something to the insurance company. And they may or may not tell you what that diagnosis is. I name that because a therapist I saw, who I thought was awesome, I had a positive experience with her, she only actually even told me that she diagnosed me with something to my insurance company when I explicitly asked her what it was. So all of that is just to say the origins of the field, at the very least, are about diagnosing a disorder and then treating that disorder. And it does impact the field to this day, if only in insurance requirements and the DSM. If the origins of the field of therapy are more medical-based and more about diagnosing and treating disorders, the origins of the field of coaching are more about identifying for people who are fundamentally okay, who are stable, just as they are, how to overcome more common roadblocks or identify opportunities for growth and move towards them. The idea that a person might even work with someone named a coach to help them with those topics, to my understanding, emerged more in the 1980s and 1990s. And part of that, to my understanding, was a kind of natural outgrowth of increasing interest in personal development throughout the 20th century, with different people writing books and giving lectures and beginning to help people live in small groups and eventually one-on-one. But there does seem to also be some link to the idea of sports coaches as well in the field of general coaching. One influence of probably many seems to be W. Timothy Galloway. He wrote this book called The Inner Game of Tennis in 1975, which was all about, perhaps unsurprisingly from the title, the idea that there was a huge mental component to tennis. And that book, The Inner Game of Tennis, it became a huge bestseller. And this guy started doing lectures and doing coaching, not just for sports communities, but especially for businesses. And he made a lot of money that way. Bill Gates, just to give one example, he loves The Inner Game of Tennis. So it's not an accident that the metaphor I started with was of this team doctor or PT versus a team coach, because I think they do kind of speak to some of the differences in the origins of the fields. So that's what I want to say about sort of the origins of the two fields. The next thing I wanted to speak to was some differences in training and education between therapists and coaches. The word therapist is broad. It can include people with all kinds of degrees. Many therapists have a master's degree of some kind, a master's in social work or a marriage and family therapy, or I think some states have a master's in counseling. Some therapists may also have a PhD. They will usually call themselves psychologists. Some might have an MD, so they've been in medical school. That would typically be a psychiatrist, but they could practice therapy in addition to perhaps prescribing and overseeing medication for mental health needs. And once they have that education, in order to legally practice therapy, therapists will typically be required to have passed a test and done a certain number of supervised hours. So that's therapy. By contrast, and I do want to be really transparent about this, there's actually nothing required in terms of training to claim that you are a coach. Literally nothing. You can just decide that you are a coach tomorrow and go out and call yourself a coach. That being said, there is training and credentialing in the field of coaching. It's just all voluntary. The most established source of credentials, the oldest, the most widely recognized, is something called the International Coach Federation, or the ICF. And the ICF does what all credentialing bodies do in all kinds of fields. It sets ethics for the profession, and if you don't abide by those ethics, you could be, lose your credential. It accredits coach training programs and decides what components those accredited coach training programs must include in terms of hours of instruction and types of supervision and topics. It also sets the standard for what you have to do after a coach training program to get your coaching credentials. So you have to coach X number of hours and be supervised for Y number of hours. And it has a test that you have to take as well. And it also says, of course, what you have to do to keep your credential in terms of ongoing education and supervision. I am a member of the ICF, and I did complete a coach training program that is accredited by the ICF. But also, in fairness, the ICF is not perfect, and some coaches have criticism of it or just choose not to participate for whatever reason. And to be totally candid, I am working with a coach right now who is not a member of the ICF, and she is freaking amazing, and I could not adore her more. So I need to do an episode some other time where I talk about what to look for in a coach and more about credentials in the field of coaching. But yes, I want to be very transparent about the elephant in the room, that it's kind of the Wild West when it comes to education and credentialing in the field of coaching. And if you were listening to this, you might have the thought, wait, why would I ever hire a coach? Why wouldn't I just hire a therapist with a master's degree or a PhD, even better? And I actually think that's a really fair question, particularly because I am a person who in general has a very strong bias towards credentials and education, and towards more credentials and education whenever possible. And honestly, the best answer that I have for you for that question is based deeply on my own experiences and what my clients have told me. And that answer is, again, based on my own experiences and what I've heard from many others, that it isn't necessarily true that more degrees is more better, at least when it comes to this kind of work. And I would also say that at least in this area, it seems like the modality and the practitioner are perhaps more important than degrees per se. I will say I do think that's true even within the field of therapy. Even among therapists, I don't personally believe that more degrees is necessarily more better. And again, on a personal level, when I was considering hiring a therapist, I met with therapists with a PhD, and I met with others who just had a master's degree. And I actually chose to work with a therapist who did not have a PhD. She just had a master's degree because I just felt like it was a better fit. So I don't personally believe that it's necessarily the extra education that makes for a better practitioner. And again, on a personal level, when I look back at the practitioners who have genuinely changed my life, who have turned me into somebody who is different in a serious way than I was before. And I realize the potential in hyperbole in saying that, but I mean it. I do not feel that it is actually hyperbole. It was coaches, not therapists, who did that work. It was coaches who, for me, changed my life. And I'm pretty sure that none of them actually had master's degrees in the field. And when I also think about the books that have, changed who I am and how I interpret the world, again, they were almost uniformly written by coaches, not therapists. And beyond my own personal experiences, I have had many, many clients who have been in therapy, often quite extensively, and they will tell me that working with me as their coach has been more helpful and sometimes significantly more helpful than their therapy experiences. And that's not to put down therapy in any way, because my hypothesis is that it's actually just that, one, they needed coaching more than therapy. The modalities are different and address different kinds of issues in different kinds of ways, as I've talked about so far, and still have a bit more to say. And also, I think it may have been because it was just a good fit for them to work with me. Because again, I think fit is probably one of the most important things for change. They just really resonated with how I approach things and how I coach. And in a funny way, I think this is actually consistent with that metaphor I shared at the beginning. You certainly want your team doctor for your soccer team to have gone to medical school. The team doctor needs to have gone to medical school. But the team coach for the soccer team, you want them to be good at coaching. to have proven that they can coach and they can help people as a coach, but they don't necessarily need to have gone to grad school. They just need to be really good at coaching and to have done their personal work in that capacity. And I will say, I do think this has some implications for hiring a practitioner that are worth naming. If you're considering hiring a coach, since it's going to be about the practitioner and the fit and their skill, I think you particularly want to make sure that you feel a good connection with them. And ideally, you want to feel that they've helped you even before you work with them. Like, you want a track record, a proven track record, ideally, of their coaching skill, even if it's not one-on-one with you. It might just be that you were coached by their ideas that exist in the world. That, on a personal level, is actually why I have this podcast and my newsletter and my blog. I want you to use them as an opportunity to get help from me before you ever hire me. Because if you resonate with me and with my way of being on this podcast or in my newsletter, if I've already helped you from this podcast or my newsletter or my blog, I think there's a good chance that it would be a good coaching fit. And if you don't resonate with me, if my work doesn't help you, then it's just less likely to be a good coaching fit. So overall, that speaks to training. I think it is a big difference between the fields, and I think it is important to address. And there's another big point that I wanted to share about the differences, and that is about how it would likely feel different to be sitting in the sessions with a coach versus with a therapist. For most people, coaching tends to feel like a bit more of an active process versus therapy. One way I like to flesh this out is to say that for many people, I think coaching ends up feeling really collaborative. Like, you and I, if I was your coach, are doing a collaboration together. We are doing a really cool art project together, and the project is you. It's your life. By contrast, for many people, I think therapy can sometimes feel a little more passive, with maybe the therapist kind of sitting back a little more, maybe listening and giving a lot of space, maybe not expecting a ton from you. And I want to flesh this out a little bit more by sharing at least 3 ways that I think you would experience it as feeling a bit more active as a client in session. The first one is that I think coaching tends to be a bit more intentional about our path and our goals. So in the beginning of a typical coaching engagement, I will do an intake. I will ask my clients a bunch of different questions about a bunch of different areas of their lives. I do this typically in the form of some writing questions that I will give them. And then I also do it live in our sessions together. And then after a couple of sessions, I will come to my clients with what I call a coaching roadmap, which is a set of outcomes that we will be working towards together. We will revise those outcomes together so my clients feel really good and excited about what we're working towards. And then at various points over the course of the typical coaching engagement, we will check in with the roadmap to say, which of these have we made progress towards? Which of these need more attention? Does anything need to be revised because you or your intentions are different now? And then at the end, we will again, revisit the roadmap. And most of the time, my clients will find that they have made really significant progress, or honestly, quite frequently kind of knocked those outcomes or goals out of the park. But overall, there is a real intentionality to saying, here is what we will be working on. Here are our goals. Because sometimes therapy can involve goals or outcomes. I want to be clear about that. But in my experience and what I've heard from others, it can often be a little more open-ended. So that's the first way that you might experience coaching as a bit more active, a bit more of an active collaborative process. The second way is that you will feel me in the room in a coaching session. So many of my clients, as I mentioned, have been in therapy, and many of them quite like therapy. But most of them will also share with me at some point that in our coaching sessions, they feel me participating more actively than they experienced in a therapy relationship. As I've said, many of them tell me at one point or another that they kind of felt like at a certain point in therapy, the therapist was maybe kind of leaning back, maybe listening a little bit more, versus if you're in a coaching session with me, you are going to hear from me. Not that I'm telling you what to do or pushing my agenda on you. I'm always very focused on helping you listen to yourself. But I will be sharing what arises in me in response to what you say. I will be asking you very active questions like, okay, when I'm hearing you say all this, it seems like your brain is telling you X and Y about what's happening here. Is that what you are experiencing? Or I will be sharing possibilities for development or for action that I see for you. And part of why I feel comfortable doing that, of course, arises again from some of these key distinctions between coaching and therapy, because I don't think that you are in a fragile place. I think that you are capable of receiving more from me. In fact, I think that you would probably benefit from receiving more from me. It would give you more to react to and push against and think about. And it's so funny, as I say this, I notice that I also have a fear that some of you might be listening to this and feeling like, oh my gosh, this would be overwhelming. Katie's going to give me all this sassy real talk or yell at me or whatever for not doing my coaching homework. And I think my clients would definitely say that that's not what it's like. My goal is to be really warm and welcoming and accepting of you exactly how you are and making this coaching experience just profoundly doable for you. Well, again, being really present and active in that process. Which leads me to a third way in which I think you would experience coaching as a bit more of an active process. And that is that coaching invites you to participate a little bit more. Part of that participation is in session. If I'm offering you new ideas or new models, if I'm gently challenging you on how you think about things, there's just more to react to. Coaching typically also involves some kind of homework between sessions. I will say that I'm very, very careful to tailor this homework to what is supportive but not draining to my clients. So some of my clients have very limited capacity. So the homework would just be to, for example, keep a particular concept in mind when you are giving feedback to your direct report. I gave that to one client recently who is very high up in the corporate ladder. On the flip side, I sometimes have clients who have a lot of appetite and energy for homework. So we will do these really cool self-observation exercises, or we'll have them practice new skills and notice what happens. Or sometimes I send my clients books that I very carefully choose for them and I send them in the mail to them because I want them to read up on a certain topic. But when I compare my experiences in coaching versus therapy and what my clients tell me, there's a bit more overall just of an expectation of implementation in coaching. And a big part of that, again, is just that I think you can take a bit more and I think you would benefit from a bit more. So that's the fourth point I wanted to share. Just that coaching tends to feel like a bit more of an active process. And there is one last thing that I wanted to speak to before we finish up. And that is the kind of quote unquote difference between therapy and coaching that I've actually heard the most often. I've seen it written in articles about coaching versus therapy. And whenever people who are not coaches or therapists tell me about the differences between coaching and therapy, they're like, oh, I've heard the difference is this. It's often this that they tell me. So sometimes this concept is floating in the air. This distinction that I'm about to share, it's also the one that I kind of feel the most mixed about. And that distinction is therapy is focused on your past and coaching is focused on your present or your future. Again, therapy is focused on your past and coaching is focused on your present or your future. So as I said, I feel kind of mixed about this one. On one hand, I think there's truth to it. I mean, obviously, if you look at, as I said, some of the origins or the history of the field of therapy, let's just name a big one, Freud, there has historically been a lot of emphasis on one's past in therapy. And even today, among the kind of loved ones or clients who I know who have spent a lot of time in a more generalized form of psychotherapy, not even Freudian psychoanalysis, which would obviously be extremely past oriented, but even just a more generalized form of therapy, many of them have still told me that they've spent a fair amount of time processing challenging or complex experiences from their past or their childhood. Versus if I was with a life coaching client, I am interested in your past because that's an important reference point. We do cover it, but we're not going to spend 8 sessions diving deep into exactly what happened with your dad when you were 7 years old, for example. I'm typically a lot more interested in what we do now, given where you are. Now, that doesn't necessarily mean, action, 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 and forget about the past. Maybe there are big feelings that need to be processed in the present. Maybe crying or grieving needs to happen in the present. But I'm not necessarily going to dive deep into analyzing and recounting the past in a lot of detail from all kinds of subtle angles. But I will say, in my own experiences in therapy, I saw a great therapist when I was living in Chapel Hill, North Carolina. We did occasionally reference my past. I mean, she knew about my childhood and certain patterns that my family had, but I wouldn't say that we spent much more time there than I would with a typical life coaching client. So that's why I feel kind of mixed about this distinction. I do think it's true that coaches in general are not super interested in the past. We're more focused on the present and the future. It's fine to bring up, as I said, but we're not going to do a super deep dive there. But I'm reluctant to claim that therapy is about the past because in my experience, some therapists might be, some are much less so. And there's just many things you might talk about in a therapy relationship. So I guess I would say this because this is, again, one of the most commonly shared distinctions that I have seen in the world. And I kind of think it's only partially true. And I personally think some of the other distinctions I've shared on this podcast are a lot more robust. But I wanted to share today because you might come across it, and I wanted you to at least have my thoughts on it. So that brings me to the end of my thoughts about some of the distinctions between coaching and therapy. I hope it's really clear. I just want to be explicit and say that I really value and appreciate therapy. I have been in therapy. I would go to therapy again. And without a doubt, I would send those I love to therapy. But I also think that coaching is a newer field. And for many folks, it's just a much less familiar field. And because of that lack of familiarity, I think at least some people in the world see a therapist when actually they need a coach. And I will say, if you are listening to this and you are thinking, oh man, I need to work with a life coach and I want to work with you, Katie, because I resonate with how you approach things and you've helped me in advance, I want to say that I would be very glad to connect with you. As I mentioned in the beginning, I offer totally free hour-long consultations for people who are interested in working together. If that's of interest to you, you can reach out through my website, katieseaver.com. And for everyone out there, I hope this gave you some more insights into what coaching is like and a bit more about, what therapy is like and how they tend to be different and what challenges tend to be best served by each. And as always, I'm rooting for you. If you really want to change in a meaningful, lasting way, that's when you need a life coach. Every client I've worked with has had incredibly personalized reasons why they're in the tired or anxious or stuck or uninspired state they're in. Working with me can help you identify those roadblocks, which are usually blind spots that you genuinely cannot see, and implement a profoundly customized, doable plan for overcoming them. I have a very small, high-end, one-on-one coaching practice. If you'd like to be my next client, reach out at katieseaver.com. I'd love to meet you.